We are here at the Helsinki-Vantaa airport in Finland. She's coming.
Woke up one day, I was fine the day before, and I woke up one day and I noticed that my tailbone was kind of hurting. At least for about 2-3 months, this tailbone pain continued, and then I also, while I was walking, felt some pain in my feet. Sure, so like right here.
Oh.
Went to see doctors because of the tailbone. Tried to put the tailbone back.
So he tried to manipulate the...
He tried to manipulate the tailbone, but I didn't really get relief from that, and I went back a couple of times, and then he also said that my spine is very mobile, too mobile. And then the next one was there was in a different city there was a bone setter. Yeah, he was recommended by my parents, and he supposed to be really good in Hungary, like a lot of people go there. He pulled on my left leg, and I got relief, but the relief didn't last long. It only lasted for about a day. So I went back maybe 2 or 3 times, and he told me that it will keep lasting longer and longer, the relief that I got, but I really didn't. Like, it was always just for a day that I felt a little bit more imbalanced, but then it would just go back the way it was. But I also went to a back clinic in Budapest, where there was a physiotherapist. She was able to determine that my right pelvis was a bit forward, so she prescribed exercises, which was just being on the floor and lifting that side up and just strengthening that side so it would go back where it should be. And I tried to do the exercises, but I really didn't feel I was getting any relief from them. So I also went to a clinic in my hometown. Basically, I went to rheumatology department because that's where they handle these cases in Hungary, and that's where I was that I have mild scoliosis. So they sent me to hot water therapy and also to a massage. Where the massages were basically done by some nurses or some, clinic physiotherapy staff, and it was hardly touching the skin really, so it was absolutely ineffectual. I didn't feel anything. Yeah, in Spain I went to a physiotherapist, but she just looked at some of the muscles, and when I was in Belfast, I went to 2 physiotherapists. The first one just did the usual routine that I've had many times, and then the second one actually did again the leg pulling. He noticed that one leg was longer than the other, one leg was shorter. So, and after he did the leg pulling, it seemed to be equaled out, and he also checked the pelvis, and he thought that the pelvis was balanced, but I didn't feel balanced. So I went back every week, and I was expecting some improvement, but I didn't really feel any. Later, then I was also in Brighton in a physiotherapy session, and during that session, basically, I just told the physiotherapist that I had this and this long time. A lot of things were tried, and then basically he just said, well, if it's been around so long, then it's probably a disc problem and I should get an MRI. And from the mainstream medical community, all I got is that I have a slight scoliosis.
Left side is higher, you're showing. On standing. And right shoulder is more...
What I always felt is as if my right hip would be lower.
Right foot seems shorter.
No täällä on vasen kato näin paljon ylhäällä.
Okay, left side is higher.
Sanopas, että vetää keuhkot täyteen.
So breathe in and breathe everything out and try to relax. Did it hurt?
No.
So it was the left side?
Nyt se olisi paikallaan.
Only the left side. The look above or exactly. A little bit shorter the left side. So
Yeah.
there's something wrong with the left hip also. Take this off.
Where?
Can you
Nyt ne on yhtä pitkät.
Never had any pain on the left, always on the right.
That means pain?
Yeah.
Breathe in and out.
Yeah.
No, näin päin on korkeuseroa
Yeah,
nyt sitten.
a little bit the right side is higher, but
No nyt ne on sitten molemmat ihan tasassa täällä.
kumpi puoli tämä?
Vasen. Eiku oikein.
Yeah, right side. Okay. So how do you feel?
Yeah, I feel alright. I still have a little bit of pain right here
In the neck?
in the neck area, but yeah, I do feel that the pelvis is more balanced. I feel some positive change. I mean, I feel quite balanced.
Funny place?
Yes.
Mäkin mä kysyin, että onko käsissä ollut mitään ongelmia, että onko nää jumissa, mutta kyllähän nää on.
Some pain there?
Yes.
You said that there's nothing wrong with your arms.
Nothing wrong with my arms.
Really?
I was just. Well, I definitely feel that my hips are more balanced, and I don't really have any low back pain or anything at all. When I walk, I feel quite balanced.
How this feels? Can you describe?
It feels fine, but at my back, no pain.
All right.
Basically, what really puzzled me with the previous physiotherapist visits is that if they say that the pelvis is not aligned, they usually try to pull the leg and try to align the pelvis that way. And for me, what was different now is that I was actually laying on my stomach, and the pelvis itself was pushed, and directly trying to manipulate it and push it back into the right position. And it just seems so obvious to do it that way, and I'm not really sure why other physiotherapists not trying to do it that way, rather just pulling on the leg and so on. So I think if your pelvis goes out due to the sacroiliac joint, your whole body just becomes completely out of balance, and different things all over your body can go out, maybe not at the same time. It's just the body is trying to compensate for being out of balance. So it keeps shifting, and then different muscle problems appear at different places of the body. What I can tell is that I definitely, like right now when I'm sitting, normally when I'm sitting, I feel like a kind of a push-pull with the ligaments and the muscles. So normally that's what I feel when I sit. And at the moment, I don't really feel that kind of pushing, pulling sensation around my hip and waist and this whole pelvis area. So that's definitely a good sign. So I do feel more balanced. Plus, I can sit comfortably. So just want to say thank you so much for your help, Yoko.